It's something that I've raised with you previously, the need to prioritise both persons who are providing home help and those who are receiving home help, because there are multiple people, people who provide home help deal with going to multiple homes, and likewise people who receive home help receive it from multiple carers. I agree very much with all of the points, or many of the points made with regard to the necessity to vaccinate people who want to be vaccinated in mental health facilities, those who are working in those facilities, as well as hospitals, and for them to be treated exactly the same. Likewise, persons with cystic fibrosis or other underlying vulnerabilities. But there was a suggestion made by some senior people in your department that persons who've had COVID-19 would not be vaccinated for some time because they would presumably, if they had it and recovered, they would have developed antibodies from that. So I'm just wondering, where is that at the moment? Because if they're not a priority, why are they being vaccinated right now? And how many people who've had COVID-19 have been vaccinated? Because I am aware of people, medics, who have contracted COVID-19 through their work, and obviously we all sympathise greatly with them in that regard, but have had the vaccine even though they themselves weren't sure whether in fact they needed it in light of the fact that they had recently recovered from COVID-19.
This came from research out of the UK, where they were looking at the reinfection rates of healthcare workers who'd had it, and it was suggesting that there was a large amount of protection afforded if you'd had it, and the suggestion was being made in the UK that maybe that's something that can be looked at. I've discussed it with the CMO. He's looking into it in detail. The current position, however, is that it is not one of the factors, and I'm straying way outside my own expertise, but if it's helpful, one of the reasons I was given was people get infected with different viral loads, and therefore the antibody response can be at a different level depending on that. And one of the things that we'd need to look into very closely is there an equal protection afforded, for example, to people? So given all of that, the position right now is very clearly that whether or not you've already had COVID is not taken into account in terms of vaccination.